For those of you who think, as you were listening to that, who's that woman talking? It sounds like Stockard Channing. It was. She graciously donated her time to help create this video. And a special thank you goes out to her agent, Scott Linder and Company, for helping to make it happen. It is now still with the crown on over there. It's so cool. I thought it was for me, then she seemed to be wearing a sash as well. So. For those of you, I said that already. It's now my pleasure to introduce Dr. Ray Martins, Whitman-Walker Health's Chief Medical Officer, who you just saw in the video. He's not only a dedicated physician, but he's last year's recipient of the 2011 Oscar E. Edwards Volunteerism and Community Service Award from the DC chapter of the American College of Physicians. During his time leading the team as Chief Medical Officer, Dr. Martins has improved all measured quality indicators and helped create an environment for care and delivery of service that some patients are now saying, Whitman-Walker is the only place I've been in this city where I am totally comfortable receiving first-rate medical care. Ladies and gentlemen, I present to you Dr. Ray Martins.
Good evening, everyone. I hope you guys aren't sick of me after seeing the video. So my name is Dr. Raymond Martins, and I'm the Chief Medical Officer of Whitman-Walker Health. It's my distinct pleasure this evening to offer our Partner for Life Award to the Secretary of Health and Human Services, Kathleen Sebelius. Secretary Sebelius, who was elected twice the governor of Kansas, was nominated by President Obama to be the Secretary of Health and Human Services on March 2nd, 2009. So I started my career with the idea that I wanted to take care of the LGBT community, especially those living with HIV. And so after academia, I joined a private practice, and I did just that. And while I loved my interactions with individual patients, I really felt like I could do more for the community at a place like Whitman-Walker. In 2007, Whitman-Walker made the decision to become a federally qualified healthcare center. When they made that decision, I realized that my personal mission was in line with the mission of the health center, and I joined the health center team in 2008. The reason I stay at Whitman-Walker is multifactorial. Most importantly, by far, is the patients. We have wonderfully diverse patients who are often challenging, but are very grateful for their care. And there are so many other reasons. We have an integrated care model that makes it wonderful for the patient and the provider to provide care. We have cutting-edge research, and we also do medical education. Today, Whitman-Walker provides services to thousands of people throughout the metropolitan DC area, with a special focus on people from the LGBT community and those living with HIV. We do this, like I said, through an integrated, comprehensive health model where we try to have as much services as possible on site so patients don't have to keep going elsewhere for care, and we can really control the environment. So I'm going to give you an idea of some of the services. It's going to be long-winded. That we offer at Whitman-Walker. So we have primary medical care, we offer primary HIV care, dental services, mental health care, which includes day treatment, addiction, psychotherapy, psychiatry. We have an on-site pharmacy, on-site blood draw stations. We have a nurse-based medical adherence program. We do HIV testing, community health and prevention, nutrition, acupuncture, medical research, legal services, and if you're not sick of me yet, our longest standing program is our free bi-weekly STD clinic. I want to focus actually on two of the programs. So one is our clinical research program. Our research program has been expanding greatly throughout the last few years, and we do predominantly HIV and hepatitis C related research. This is great for the patients, so patients that don't have a lot of options, we can offer them additional options through those programs. And then the information we gain from those research trials, we actually present at national and international meetings. The other one I wanted to highlight, the other program, is our medical education. We have medical students and residents come from throughout the DC area's universities, but as far away as the University of Southern California. I don't know how that relationship started. But, and what's great is I feel like we're putting together the next generation of healthcare providers that are going to be serving the underserved. So when they come here, they get to work with the underserved population, really focus on treating the LGBT patient, and focus on treating people with HIV. So I'd like to give you a patient example of someone who's benefited from our integrated care model. I'm going to call this patient Carl. This is not his real name, and I changed a lot of the other demographics so he remains confidential. But Carl was a 41-year-old, but the story is consistent. Carl is a 41-year-old unemployed black man who had bipolar disorder, who tested positive for HIV on our mobile van. When he tested positive, we immediately transferred him to our Elizabeth Taylor Medical Center. There, because he was unemployed and didn't have health insurance, he met with our public benefits unit, who eventually got him on Medicaid. After that, he met with his nurse and medical adherents to address any barriers to care, and that same day he saw his medical provider. And between the medical provider and the nurse, that is going to be his primary health care team moving forward. He was pretty sick when we first saw him. He had a fungal infection in his mouth called thrush, and he had chronic diarrhea. But his physician was able to prescribe him medications that he filled at our pharmacy for $1 a prescription. We got blood work. He eventually started on HIV medications, and we referred him to our mental health department. So I'm happy to say now, Carl is doing tremendously well. His bipolar disorder has stabilized, his HIV is controlled, and he's currently employed as a gardener at the Smithsonian, a job of which he loves. So Carl's story brings me to the reason that we're offering our Partner for Life Award to Secretary Sebelius. Secretary Sebelius' job is to implement the Affordable Care Act. She's responsible for reforms that will help 34 million uninsured Americans get health coverage. Under the law, she's also carrying out policies that put a new focus on wellness and prevention, support the adoption of electronic medical records, and help recruit and train more primary healthcare providers. One of the centerpieces of the legislation is to find better and more cost-effective entry points for under and uninsured Americans to enter the healthcare system. For this reason, the Secretary has shined the spotlight on federally qualified healthcare centers such as Whitman-Walker. Her vision of keeping the focus on these health centers by dedicating resources, information, and expertise makes her a true partner in care. The road ahead for all of us in delivering better health care is a journey that no one institution can take alone. Whitman-Walker Health will continue to partner with the Secretary as we improve our electronic medical records, assist our patients in navigating new opportunities to receive health care coverage, become a true medical home for those that we serve, and ultimately to ensure that all Washingtonians that need and deserve excellent medical care get it. So it is now my honor to present Secretary Sebelius a Whitman-Walker's Health Partner for Life Award.
Did that without dropping it. I'm thrilled. I have to tell you, I'm delighted to be here tonight and to have a chance to join this celebration, and I'm very, very honored by this award. I want to thank Ray Martin for not only his kind introduction and presentation, but the terrific work he does. I want to thank Don Blanchard for his leadership here at Whitman-Walker, and Gardner and West for your not only ongoing efforts with this center, but for mobilizing this great gala tonight. I have to tell you, you know how to make a girl kind of feel bad. First of all, my home movies don't look anything like this. And then, you know, as part of the trio of dazzling women, you have Elizabeth Taylor, and Stockard Channing, and Gwen Ifill. So, I'm not worthy. I'm glad to join that amazing group. And you all are better dressed than I am, so I agree with Gwen. I get my fashion tips. But it is a tremendous honor to be with you tonight. And I want to just recognize the fact that Be the Care is a great motto for all of us going forward. But Whitman-Walker has represented for a long time the gold standard in community health. From the days this clinic first opened its doors, it welcomed folks who the rest of the health system shut out, and provided the kind of quality care that people just couldn't get anywhere else. When patients living with HIV and AIDS were misunderstood or mistreated, they came to Whitman-Walker. And when the LGBT community was ignored or discriminated against, they came to Whitman-Walker. So when other underserved communities didn't receive the care and respect that every human being deserves, they also began coming to Whitman-Walker. So there are 80,000 men and women who come through the doors every year. And for them, Whitman-Walker means access to quality, affordable, culturally sensitive care. It means the dignity of good health and freedom from worry. Now, the good news is the rest of the healthcare system is starting to catch up. We've begun to erase a lot of the stigmas around care, and remarkable advances in care and treatment are allowing people across the country living with HIV/AIDS to enjoy full lives. But there's clearly a lot more to do. Right outside of this door, an epidemic continues in this, our city, in Washington, D.C., our nation's capital, with 3% of the district residents fighting HIV or AIDS. Now, nationwide, many populations still suffer disproportionately. Gay men make up more than half of all the new infections. African American women are 15 times more likely to have HIV/AIDS than white women. And that's why Whitman-Walker is just as vital today as it was when it first began providing care. And it's a reason that the Obama administration is committed to doing everything we can to improve the health and lives of our country's most vulnerable populations. So we've taken action to protect a patient's right to be with his or her family in time of need, however that family is formed. The health care rules around family we've begun what may be one of the most important processes ever begun, which is to include sexual orientation and gender identity in HHS national resource. And once that research is done, so no longer will health decisions be made on the basis of anecdotes. We've rededicated ourselves to the national and global fight against HIV/AIDS. Our national HIV/AIDS strategy has translated into action as more resources reach the communities where they're needed most. HIV prevention funding has increased every year after nearly a decade of flat funding. And we have been implementing the Affordable Care Act, which is going to dramatically expand access to care and health coverage for people with HIV/AIDS, and it already has begun to do that. Now, this work is why, for the first time, we actually can envision a world free of AIDS and truly embrace the promise of an AIDS-free generation. a vision set out by President Obama and Secretary of State Clinton this past World AIDS Day. As we prepare to host the International AIDS Conference, which frankly could have never happened unless this administration repealed the travel ban, we wanted to welcome you. So when that international conference comes to DC this summer, we have to dedicate ourselves to continue to work together toward this vital goal, an AIDS-free world. Whitman-Walker Health Center is a shining example of the work we need to do across the country to get it done. Now, Jeff and Noah, who were featured in the video we just saw and who are with us tonight, have said Whitman-Walker has been in our corner. Thousands of patients and family, whether they are experiencing HIV/AIDS or other health issues, have felt the same way over the years. And that kind of connection is what we want to do across this country. We all need someone in our corner. Every American deserves a place in their own community where they can go for safe, quality care. We can't build a Whitman-Walker in every city and town in the nation, but we can build a healthcare system that provides the same kind of comprehensive, community-based care, no matter who you are or where you live. And we finally are going to be able to say in the United States of America, after a very long time waiting, that in 2014, every American will have the access to quality, available health care, and that is long. So I'm here on behalf of this administration to accept this wonderful award. We're here as partners for life. I am honored to be your partner. I am really honored by the care that you give day in and day out to amazing people. And what we want to do is help spread this story, to help others empowered to be their own care and make sure that the example set by Whitman-Walker as one of the gold standards in community health clinics is actually one that's experienced by millions more Americans across the country. So thanks very much.